Hi, my name is Sergeant Weaver, and have you ever noticed that in trauma patients, they lose a lot of blood? So how are we going to help that trauma patient? What's going to be the most important thing that we can do for that patient? Fluid replacement. So today I'm going to demonstrate how to properly initiate an IV using 500 bags of lactated ringers. Alright, the first thing that you want to do is you want to gather all your equipment. Alright, you need to make sure you have your fluid, your tubing, some tape, a pair of gloves, tourniquet, alcohol pads, a couple of 2x2s, and a needle, and your sharps container. Alright? Once you've gathered all your equipment and you're sure you have everything that you're going to need to properly insert the IV, you're going to start with your bag. You're going to take the bag outside of its protective cover. Alright? You want to check this bag. Check for the expiration date. Expiration date February 2009. Still good. Check, make sure there's no leaks, it's not discolored, no cracks. So you're good with your bag. Next thing you want to do, you want to open up your tubing. And you're going to inspect it for pretty much the same thing, minus it's not going to leak. Alright? You want to just run your fingers down, make sure that there's no cracks in the tubing. Any damages that are done to this tube can end up inside the patient's arm. Okay? You want to make sure that both your covers are intact. Alright? Once you've done that, you can go ahead, find somewhere to hang your bag. Alright? You're going to remove this piece from the bottom down here. Just go ahead and pull it off. Discard it. The next thing you want to do, without touching this part right here, you want to remove the cap, place it inside the bag, kind of a little twisting motion, get it in there. Alright? Fluid is then going to begin to drain through. You want to make sure that you drain all the air out of the tubing, so it's going to leak a little bit. Then close your line down, so now it's not dripping. You want to squeeze, fill this up to about halfway. Alright? Set this off to the side. Don't need it anymore. Alright, the next thing that you want to do is you want to look for a site. So first, to protect yourself, you want to go ahead and put on a pair of gloves. This is more for your protection, not for the patient's protection, so just make sure you're protecting yourself. Don't want to get the hit. These gloves are tight. Okay. Alright, when selecting a site, you want to go ahead and place the tourniquet about 2 to 4 inches above the elbow. Make sure it's tight. Okay? Just kind of give it a little feel. You can ask the patient, go ahead and pump your hand for me a few times. Alright? Once you find one that you're comfortable with, you see the location of it. So I found one that I'm pretty comfortable with. You can go ahead, loosen the tourniquet, grab an alcohol prep, and you want to clean in a circular motion outwards. So I'm going to start right here, kind of go in a circle around my entire site. Done with that. So next, before I'm going to stick, I want to go ahead and check my needle. So pull the needle out, go ahead and take the cover off, check for any damages, any cracks, anything. You want to make sure that your catheter can move freely. So once it's in the arm, you can go ahead and advance it up with no problem. So, needle's good. Set that down. Alright, then you want to come back. You can go ahead, this is just something that I do, you can go ahead and grab some tape, kind of set it off to the side, so that way when you go to secure it down, you don't have to try and fumble with already taking tape off. Okay? You want to come back, get your tourniquet back on nice and tight. The tourniquet should not be in place for more than 2 minutes. Alright? So, I know where my site is. Got my needle. I'm going to go ahead and grab my tubing, place it down here where I can reach it. And I'm going to go ahead and I'm going to stick. You want to come in at a 45-degree angle initially. Go ahead, give it a little stick. You should see some blood fall in the back of the needle. That's called the flash. When you have that, go ahead and drop your needle down to about to about a 90-degree angle. Advance it about 1/8 of an inch. And then slide the catheter forward without moving the needle. Okay, you want to apply a little pressure to the top of the vein. You can go ahead and push this button. It'll retract the needle. Take the protective cover off of the end of your tubing and go ahead and tie that on there. This time you want to remove the tourniquet. Never let go of the catheter until it's secured down. You can go ahead and turn your drip on. Watch that it's dripping. Now you can take a little 2x2, go ahead and clean it up a little bit. Take a dressing here, kind of place it right over top of that. Do not cover the site, because you're going to still need to see that site to ensure that there's no swelling or redness. You want to tape it down. You can bring it around the thumb, tape again, and tape one more time just to ensure that it is secure. So the IV is in place. It is dripping. At this time we want to make sure that there's no redness or swelling around the site. Looks good. You have now successfully initiated an IV. So it's not the easiest thing in the world to do. It takes a little bit of practice. But you can, in fact, save a life if you're able to do this within a certain time limit. Thank you. That's all I have.